Welcome to Hey Doc with me, Dr. Katie. If you're new on here, an extra welcome to you. And for our returning subscribers, as always, thank you so very much. We're going to get right into today's video, but before we do, remember the custom on here is for us to ask you to smash the like button and to subscribe. Thank you. In today's video, we will be talking about the causes of infertility in men. Infertility is defined as the inability to fall pregnant or conceive after a year or longer of unprotected sexual intercourse. Pregnancy is a result of a process that has many steps. To get pregnant, a woman's body must release an egg from one of her ovaries. A man's sperm must join with the egg along the way, which is the step of fertilization. Then the fertilized egg must go through the fallopian tube towards the uterus. The embryo must attach to the inside of the uterus, and this step is known as implantation. So infertility results from one or several of these steps. The reason I'm doing this video about causes of infertility in men is because often infertility has been blamed on the woman, particularly in some cultures. And so this video aims to educate and show that the cause of infertility can also be from the men. We're going to start with medical causes. The first is varicocele. This is a condition in which the veins in the man's testicles are enlarged. Although some men may experience no symptoms, varicoceles can affect the shape and number of sperm cells. Then there are infections, which includes infections that affect the epididymis, the testicle itself, and often these infections originate from a sexually transmitted disease that the man may have had but did not get treatment for it. And the common sexually transmitted diseases that can affect a man's reproductive system are gonorrhea and chlamydia. These not only interfere with the production of sperm cells, but they also affect the quality of the sperm that is produced. And when left untreated for a long period of time, this infection can lead to scarring, and this scarring will prevent the passage of sperm cells along the various tubules, along the different tubes in the man's reproductive system. Ejaculation issues. Conditions such as spinal injuries, diabetes, surgeries to the prostate, the urethra, or the bladder can lead to retrograde ejaculation. Retrograde ejaculation occurs when the semen enters the bladder during ejaculation rather than emerging out of the penis. After testicular trauma, torsion, or procedures such as biopsies, the blood-testes barrier is breached. In some patients, the fact that the immune system becomes exposed to large amounts of sperm cells in a short period of time through a breach of this barrier leads to anti-sperms antibodies being released. These anti-sperms antibodies mistakenly identify the sperm cells as harmful invaders and attempt to eliminate these healthy sperm cells. Certain brain tumors can lead to infertility in men. Improper function of the hypothalamus or the pituitary gland in the brain, which can occur due to the presence of a benign or malignant tumor on these glands, can lead to too much prolactin being produced. This leads to low or no sperm production because too much prolactin affects the sperm cell count. In some cases, surgery, chemotherapy, or radiotherapy can be used to treat these tumors, thereby helping to restore the quantity and quality of the sperms being produced. It's scripture time. Today's scripture comes from John 16, verse 33. I have told you these things so that in me you may have perfect peace. In the world you have tribulation and distress and suffering, but be courageous, be confident, be undaunted, be filled with joy. I have overcome the world. My conquest is accomplished, my victory abiding. Becoming a Christian doesn't promise a life free of challenges. On the contrary, Jesus emphasized that choosing to follow him may result in persecutions. This is seen in John 16, verses 1 to 4. The joy experienced by those born again in faith stems from the assurance that Christ has already achieved ultimate victory, that nothing in this world can undo. Christ forewarning us of impending difficulties, which we see in John 15, verses 20 to 21, serves as a source of reassurance for believers, affirming that these hardships do not catch God off guard. The triumphant and resurrected King of Kings and Lord of Lords can reside within you, His Spirit dwelling in your being. Regardless of the challenges you may be encountering today, never entertain the thought of defeat even for a moment. Within you resides the victorious and conquering King of all, accompanying you through every circumstance. You are His own. So lift up your head and be confident and assured that He will come through for you and answer your cry in the time of need. I hope that you were encouraged by this scripture. Back to the causes of infertility in men. Undescended testes. If you were once diagnosed with undescended testes when you were born, and this was not surgically corrected after it persisted beyond the age of 1 year old, and so this condition that you were once born with that may have resulted some years after your birth, but was not corrected promptly, could be the reason why you are struggling to conceive. Defect or blockage that occurs within the tubules that transport the semen. This blockage can occur at any level, including in the testes themselves. Certain medication like testosterone replacement therapies, be careful with the long-term use of anabolic steroids, and cancer treatment like chemotherapy. Having had prior surgeries carried out on your reproductive system. Certain surgeries may prevent you from having sperm cells in your ejaculate, including testicular surgeries, prostate surgeries, large abdominal surgeries performed for testicular or rectal cancers. These are just a few types of surgeries that can affect your fertility amongst many others. On to environmental causes that causes infertility in men. Overheating of the testicles. Elevated temperatures of the testicles may impair the quality and quantity of sperm cells produced. Elevated temperatures in the scrotum area can impair the sperm production and function. Frequent use of saunas and hot tub can temporarily impair sperm cell counts. Sitting down for a long period of time, wearing tight underwear or tight trousers may increase the temperature in your scrotum and may slightly reduce sperm production. And finally, certain genetic disorders. Genetic conditions such as Klinefelter syndrome, Y chromosome microdeletion, myotonic dystrophy, and other less common genetic disorders may cause no or low number of sperm cells being produced. That's it for another video. Thank you so much for watching. Before then, do remember to check out some of the numerous other videos that we have right here on HeyDoc. We'll see you later.